The Vielight for brain health. I'm going to tell you today why we recommend it for our patients, mostly with dementia, post-concussive syndrome. Those are our two primary issues that we deal with, that we recommend this for. So the Vielight, let's talk about it. There's a study done for specifically with this device for dementia. This is not a laser, it's LED. Laser is what we use most often for brain health, but LEDs are, this one in particular has shown some good research, so we recommend it. There's particular things about it that make it useful. So this first study, there were only 5 patients, but they were an average of 78 years old. This is for dementia. They measured them with 2 different assessments. One was called the Alzheimer's Disease Assessment Scale, cognitive subscale. So it's basically measuring for things that people with Alzheimer's or mild cognitive impairment start to deal with: learning, naming objects, following directions in memory, and then also the mini mental state exam, the MMSE, assessing short-term memory, simple math calculation, naming objects, and following directions. So what did they do? And this study was 12 weeks long, and it was just piecemealing it together. They were using a few different people at a few different times, but it was really, really interesting. So for the ADAS-Cog, they found a dramatic improvement, a 7-point improvement in the learning, naming objects, following directions in memory. And I'll tell you how they used it exactly in just a minute. They went from a score of 36 to 29, and an average. Then they had a full week where they didn't use it. Okay, they got better. Did they get better for what reason? Because there wasn't really a control group, but the control group was their own people that went through it the first time, 12 weeks, and they said, okay, let's stop it. Let's see if you're any worse. And it varied. So some people got worse. Most people, I mean, there's only 5 people. One of them dropped out, though. One of them actually continued to get better, even without the treatment. So one of the 5 participants worsened dramatically upon withdrawal of the therapy, so they restarted it and quickly saw some improvement that came on quite rapidly. His control data was excluded because he didn't finish the 4-week withdrawal, and he didn't want to stop it. Right? It was so good. So for him, it wasn't really part of the study anymore. Also, in the mini mental state exam, the treatment group went from 17 to 20, which in this case going up is good, better score, 3-point improvement. And when they pulled it away, they stayed about the same. Their score stayed at 20. So that was good. It was a maintained improvement. All right, so that was just a few people. What do we do? How do we apply that? With the treatment group, they had 810 nanometers, this near infrared light. I'll turn this baby on. See if you can see that. I don't think I've turned it on yet. Once you turn it, I may not have the battery plugged in. So once you turn it on, these little red lights show up, and they are right directly against your head. So they did it in the head 2 times a week for 20 minutes. Then they went to 1 week times 20 minutes, 1 time per week, 20 minutes for 10 weeks. They also had the nasal probe. What is the nasal probe? That's this little dewdropper here. One of the shortest routes for the thinnest areas of skull is with the nasal probe. So you just slide it in there, and it gets to the blood vessels to go to your brain, as well as going up to that orbital cribriform plate, where there's a really short, thin distance between your skull and outside and inside. They did that 6 to 7 days per week for 25 minutes for the 12 weeks. The control group was withdrawing, no treatment for 4 weeks. All right, worked pretty well. What about another one for dementia? Now we have a second study for dementia. So what did they find with this? Initial patients and conditions. They had 8 patients, average of 80 years old. So now we're still dealing with people who are quite old and likely to have dementia. And they were diagnosed with dementia, and they measured them with 3 different scales. The ADAS-Cog again, measuring learning, naming objects, following directions, and memory. They found that people did this had deficits in these things, which is what you find with Alzheimer's or mild cognitive impairment. They also did other neuropsychiatric inventory tests looking for behavior things, behaviors that are common in dementia, problems like frequency, severity, and impact on caregivers and caregiver distress. So how often did they have behavior disorders of various types? And then functional magnetic resonance imaging, fMRI. Again, in this study, there were no adverse events, which is really good. The same thing found in the first one, no adverse events. What did they find? They found that people's learning naming objects, following directions in memory improved quite a bit. They did have a good control group in this one, as well as a treatment group. It's a small study, right? So only 8 people here. But they went from an average of 38 to 32, a 6-point improvement in this scale, which was good. The blue line is the treatment group, and the red line is control group. How did the control people did not receive treatment? How did they do? They got worse, 7 points worse. What about other neuropsychiatric testing? We're looking at things like depression, irritability. The treatment group went from 35 to 14, a dramatic improvement here. And the control group went from 11 to 20, so they got worse. This is pretty dramatic change. Either one of those, getting worse that much or getting better that much, but when you have the same people in the same period of time, not the same people, the same period of time, you have control group going one way, the treatment group going the other way, it's really pretty extreme. So what do we take from that treatment group? Use this 810 nanometer near-infrared light, the Vielight, with a power output of 25 milliwatts, using the nasal probe, and then the 5 probes on the head. So I have one for the frontal lobe here, and one on each side of the sensory motor strips, parietal area, and the occipital area. They did it 3 times a week for 20 minutes for 12 weeks, and they found that it was quite good. So a little note there, they used a gamma frequency. We'll talk about that later. What is the gamma frequency? It's the 40 hertz. And they found that in other research that reduced beta amyloid plaques, that's the plaques that show up in the brain with Alzheimer's, reduced that in this particular study, not with this device, but they said, hey, let's go ahead and apply that. So they started with 40 hertz with this one as well. What about using the Vielight for post-concussive syndrome? In this case, we're specifically looking at CTE, likely anyway, chronic traumatic encephalopathy. The initial patients, they had 4 patients, they're 55 to 74 years old. 3 played in the NFL and 1 played in college. The diagnosis, repetitive head impacts, and poor performance on these tests and possible CTE. They measured this with neuropsychiatric tests, assessing things like attention, where is this? Mental speed, memory, reaction time, and problem solving. And then other health questionnaires assessing depression, sleep, PTSD, pain, tinnitus, and more things. They found during the study there were no adverse reactions, no adverse events. That was great. They found this is doing no harm as far as they could find out, and we'll show you it did do some quite good. So their neuropsychiatric tests, they found that the treatment, they had better memory, and during the control group, they had better or same and worsened memory. So what was the control group? That was 4 weeks of no treatment in this case. So they so 6 weeks of treatment and then 2 months without. So this is a typo here. So they had 2 months without. During that 2 months without, they had better, same, and then eventually got worse. What does that mean? Well, when they first pulled it away, some people continued to improve, but some people got worse. So this is a visual spatial memory test. And so basically we're looking at visual spatial memory in this case. So during treatment, they improved. They withdrew. After a week, they had continued to improve. They continued to improve at 1 month, and then they got worse. Then they reintroduced treatment, home treatment in this case, and they noticed the memory went back up. And this other memory test, visual spatial memory, they improved with treatment in the office. No treatment, they did pretty much the same, got a little bit worse at 2 months, but then restarted treatment at home and spiked back up in improvement. That was pretty major. What about behavior and mood, PTSD and depression? So we also recommend this with our patients with PTSD, depression, or anxiety. In office treatment, they noticed less PTSD and higher and less depression, not higher depression. So with treatment, they improved significantly with PTSD, and their Beck depression inventory improved significantly as well. When they withdrew treatment after 1 week, they had continued to improve. Then they gradually started getting worse. At 1 month, at 2 months, they got considerably worse, reintroduced, and the PTSD improved even more than it had the first time. And with depression, improved quite a bit, and then maintained. And then about a month of no treatment, got worse, restarted treatment, improved back to their baseline, which was 0. So really good results with this. What's our takeaway? Vielight for concussion, in this case traumatic post-concussion, probably CTE. Where you're dealing with, it's a lot like Alzheimer's in this case, in the fact that it's a progressive degenerative neurological disorder of the brain. So they used the near-infrared light, 810 nanometers in this frontal lobe, somatosensory lobes on the left and right, and then occipital lobe posterior aspect. 20 to 40 minutes. In this case now with the power that it's set at now, it's 20 minutes, but they had different powers that they used. So they had to go different lengths of time, 20 to 40. In this case now it's 20 for 6 weeks. The control group, the control period, same group, most brain functions worsen within 1 month of no therapy and almost all worsened after 2 months. But they improved again after restarting therapy. In this case, they did it at home for 4 weeks. So what are our recommendations for anxiety, depression, PTSD? Purchase for long-term home treatment, typically because this is something that's going to worsen without treatment. 20-minute per session, 3 to 6 days a week for 6 weeks, and then continue at 3 times a week. You might do boosts for, if you're starting to regress, you might do a boost. So you do it more frequently as needed. There's an optional in-office approach that we can take. If you're not sure if you want to purchase a unit, it's like, I want to see if it's going to work. Well, it takes a little time before we know if it's going to work. So 20 minutes per session, 3 times per week for 6 weeks, 18 sessions, and then you can see if it's going to work. If it's beneficial, if there's symptom improvement, then you can go ahead and purchase it. So you're going to use it long term to continue to benefit you. Another option there is you do the treatment for a little bit and then you withdraw. You go, okay, I got better. Now I'm going to see how I do without it for 4 weeks or 8 weeks. And if you notice you get getting worse again, then you're like, yeah, I definitely need to purchase it because my maintenance, my improvements are not going to maintain. What about gamma frequency? Gamma is this 40 hertz frequency in the brain. This Vielight and other units often use this 40 hertz. Why does the frequency of the pulsing matter? So pulsed lights are usually more expensive. The lights that just have, they're not pulsing, they have a certain wavelength, but they don't have a pulse on and off. In this case, the units that we have are all pulsed. Treatment group, near infrared, 810 nanometers. So what they did in this case, this study, they used just regular light, visual light. They didn't use this unit for this study. This is another group. And they found that visual stimulation at a certain frequency reduced the plaquing, the beta amyloid plaques in the brain. It was pretty major. And they had a control group, which was they would just do random frequency. So they had little animals, and they would check the amount of plaques in the brain. They gave them amyloid plaques. They gave them a disease where they would build up amyloid plaques. They started to build up the plaques. It was interesting. They started having, there's a natural frequency in the brain of this 40 hertz, and they started to lose that frequency, a natural production of that, even before the plaques built up. Then the plaques built up. Then they started to do the light therapy. And then they noticed that not only did the brain start to entrain to that 40 hertz frequency, but they also started to reduce the amount of plaque buildup in the mice that had this 40 hertz stimulation. In this case, it was a visual stimulation, not a transcranial stimulation. So we don't know for sure if it works that way. but that's why the Vielight now uses 40 hertz, because the probability is that it will have the same effect on the other areas, because we do know that this light starts to entrain the brain at certain frequencies and help certain areas connect, which is how the brain works. It's not just one area working, it's this interconnected brain that really makes our brain shine, function the way it's supposed to. All right, have a wonderful day, and may God bless you.